Good evening and welcome to the PharmAssist virtual learning experience. As always, I would like to begin the program tonight with a very brief disclaimer, and that is, the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of that nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that out of the way, I'd like to welcome you again to the PharmAssist virtual learning experience, and that is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. PharmAssist takes place every Monday night at 7 p.m. Eastern Standard. Typically, what we will do is we have a live medication instructional program on 3 different fertility products, and then we have an interactive Q&A throughout the program. Tonight, we're going to be doing something a little bit differently. This is a best of some of the presentations that the nurses have given over the last few months. And you'll also notice that we're doing 4 programs showcasing all 4 of our nurses. And as I said, we're always joined by various amazing HCPs each week from across the nation to provide you with that real world experience that you want, just as if you were sitting across the table from them in the clinic. And so today we're going to be joined by all 4 of our nurses, so I think it's going to be a great time. Return next week so you can join us via Zoom or Facebook Live, where you can be a part of the program and discussion by sharing your questions in either format. And thank you again for your time and interest this evening. I want to turn it over to the nurses, and it's going to be a great evening. Thanks again. Take it away, nurses.
I'd like to talk to you about administering Avidrel. If your prescriber has recommended you take Avidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avidrel comes in a little package like this, and you simply open it up and remove the inside part, like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or 2 and down an inch or 2, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a Sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avidrel. That one was short and sweet, really easy to do. A question that people ask me often is, why do sometimes you get prescribed HCG and why do sometimes you get prescribed Avidrel? That's an individualized prescriber preference, but it may also be based on specific characteristics about you, just like we mentioned earlier with the Gonal-F. So your provider will prescribe and order these medications through Mandel's, and the right one will be sent to you. So I'll open up now to any questions that you may have.
Perfect. Okay, thank you very much. I think I'm actually supposed to read the disclaimer one more time. So let's just say again, the PharmAssist MedTeach program brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the MedTeach nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that being said, I have a question here for you that says, a friend of mine had a bubble in her vial of Avidrel, but she said that it wasn't a problem. Is that true, or can it be dangerous?
That's a great question, and that's something that everybody worries about. I think we've all watched too many soap operas and movies, and we see the way to bump somebody off is just to put a little bit of an air in a syringe and inject it. but actually you'd have to give a whole lot of air directly into an IV for you to even, your heart to even skip a beat. So don't worry about that at all. Don't try to thump it and do everything that you can to try to get out every little last bit of air. That's not going to cause any harm, any danger, any pain. Don't worry about it at all. If you see a big bubble in there, you can try to get it out, but those little tiny ones, don't worry about that at all.
Perfect. And also, I guess we learned to not get any of our medical information from soap operas. So
Exactly.
once again, learning things outside the bubble here, no pun intended, when you come to the PharmAssist program. Okay, we have another question here. It says that last time I took my Avidril, I experienced a reaction near the injection site that was very itchy. Is there anything that I can use to treat it? Should it be before or after the shot?
Great question. Most commonly, a little local reaction is going to be after taking the human-derived HCG, not the Avidril. But no matter what, if you have a little localized injection site reaction, it's fine to put a little topical anti-itch cream, maybe some Benadryl cream, something like that. It's fine just to apply that topically. But if you do have that happen, it's self-limiting. It may feel like a mosquito bite for a day or two and it's going to go away. That in no way implies that the drug wasn't appropriately administered or appropriately absorbed. As long as you give it, it's going to be absorbed just like it needs to, and you have no worries about any local reactions at all. It's very uncommon to see that with Avidril.
Thank you, Karen, very much. So there is a question. You touched a little bit on this, but I think this question has come up before, so it's worth touching on. My nurse keeps referring to it as the trigger shot. What specifically does the trigger mean, and what is Avidril actually doing as part of my cycle?
Great question. A lot of people do call it a trigger shot. I don't generally call it that, and I thought that was something that patients said, but I hear a lot of providers say that as well. So it triggers a couple of things, both the HCG and the Avidril. It triggers the final maturation of the eggs. Right before the LH surge or the administration of HCG or Avidril, the egg's real sticky and it'll stick to the inside of the follicle wall. And if you try to do an egg retrieval and somebody didn't take their HCG, it is dang near impossible to be able to get the egg out. Two, not only is it sticky, but it also hasn't quite finished maturing in this Avidril or HCG helps the egg to finish maturing. Now, if you don't do an egg retrieval, if perhaps you're taking this for timed intercourse or maybe for ovulation induction with an insemination, this will be told to be given to you at a specific time, so you'll know right when to schedule that procedure or to have intercourse. If that's the case, the egg is going to release after a certain number of hours. It's probably between 40 and 44 hours after the HCG that the egg will release, but generally it's between 34 and 38 hours that the final maturation will occur. That's another little thing that I should probably mention here. If you were told to take your HCG, for example, 35 or 36 hours before your egg retrieval, and the office is running behind and now it's 36 and a half hours or 37 hours, don't freak out and think it's going to make you ovulate. There's always a little wiggle room that we as clinicians will give, so to make sure that you're not going to ovulate just before your procedure is scheduled.
It was very in-depth, and thank you very much for giving all the information. See, these are the things that people really, sometimes we think people understand what's happening with all the different shots, but that's why we like doing these types of open discussions so people can see what their questions might be that they maybe don't get to ask when they're sitting in front of their healthcare provider. So here's a question that maybe is pretty apropos right now. I'm going away on vacation this weekend. Do I need to keep my Avidril refrigerated or in a cooler or something while I travel, or will it be okay? The heat wave.
Yeah, I would recommend that you keep your Avidril in the fridge, just because it's July. But whenever it is, you want to keep it cool. Look at the back of the box, and it'll tell you to keep it cool, and that's exactly what you should do. Now, if you're going to to your parents' house to have dinner and you need to take the injection in 4 hours, I wouldn't worry about refrigerating it just for 4 hours or packing an ice pack or something like that to go to your folks' house. But if it's going to be for more than 6 or 8 hours, I would recommend that you keep it refrigerated, and certainly if you're traveling, to keep it on an ice pack or in a cooler. Don't want to freeze it, but you want to just keep it nice and cool.
Great, thank you very much. And that's the last question we have right now. Again, remember, if you think of something after the fact, you can by all means bring that up at the end once we get to more of an open session. And another thing, if you have any questions that build upon somebody else's, something we see that happen a lot where somebody asks a question based on an answer that Karen gave to another question. So feel free to jump in and keep the conversation going. But other than that, right now, we are done with the individual questions that are in, right? So I'll throw it back over to you, Karen, to just, as we get ready to move on.
All right, that sounds perfect. And always feel free to ask your healthcare provider any questions that you have. Sometimes I know when I'm going to see my own providers, I'll feel a little bit nervous or maybe forgetful, or maybe that's my age, who knows. But I'll jot down some notes and have my notes ready so that if I have some particular questions I want to make sure are answered, I've got them right there in front of me, a little sticky note that I can remember to ask. But this is a great forum to ask questions as well.
Instructions for the Gonal F multi-use vial. First, collect all of your supplies. So you will need your vial of medication. You will also need the pre-filled syringe that's full of saline or water. And you will also need one of the provided syringes. The medication will have a cap on it. It'll just pop off like this. You'll see the rubber stopper there. At this point, you can take your cap off of the pre-filled syringe. I recommend getting into the habit of taking an alcohol prep wipe to wipe off the rubber top of the vial. In order to compound the medication, you will just push your needle into the vial of medicine, inject all of the water into the vial. Once all of the water is in the vial, you can take out the syringe. It can go into your sharps container. And at this point, you have your medication reconstituted. Now you'll use this vial multiple times. So at this point, you can go ahead, take your syringe, peel it open. It peels open like a banana peel. And then at this point, I recommend pulling back on the plunger until you meet the dose that you're prescribed to by your provider. So for the sake of this video, we will use 150 units. So I pulled back 150 units of air and take off the cap, insert it into the rubber stopper, inject your air in, flip it over, and pull back to 150. If you get a little bit of air in the syringe, that's okay. You can push it back up and restart. So go back until you see 150. You can see I have it here. And then take out your needle. Now we want to go ahead and prep the site for injection. This is a subcutaneous injection, so pinching an inch of belly fat or pinching an inch of skin on the thigh are both appropriate areas for this injection. So once you've chosen your site, you will take an alcohol prep pad, clean the site off, let it dry, and then you will pinch that inch of skin and go in fast at 90 degrees like a dart. And then push the plunger, hold it for a few seconds, then take the needle out. You can get rid of the needle into your red sharps container, and you've completed the injection. Okay, so that was the Gonal F multi-use vial. Now, keep in mind it is multi-use, so be sure you don't throw that vial away after you've done just one injection. You want to save it until it's completely empty. It will likely get you multiple days out of that vial. Now, you've probably heard of this medication in a pen device form as well, and we'll be covering that next, so be sure to stay tuned for that. Any questions out there yet, Craig?
Yes, yeah, we actually just got this question just came in on Facebook that says, what does Gonal-F actually do to impact my cycle?
Yes, great question. Not only do we want to know how to do these meds, but we want to know why, right? So your gonal F is actually stimulating the growth of follicles within an IVF cycle. So within your ovaries, there are follicles. Within follicles, there are eggs. So naturally, our bodies each month, our brain chooses usually one dominant follicle for the month in a natural menstrual cycle. Instead of that, in this case, we are actually stimulating the growth of multiple follicles, multiple eggs within a cycle. So that's what the gonal F is doing. It's just kind of overriding what our brain would normally do, and it's giving much more of that hormone that will result in many more follicles developing over the cycle compared to just one within a natural menstrual cycle. So of course, our goal with this is to retrieve multiple eggs at the end of the cycle, right? Every IVF cycle, we're hoping that we're getting multiple eggs to fertilize. So that is what the gonal F is doing for us. Good question.
Thank you, Caitlin, very much. I appreciate it. I know a lot of times these questions, like you said, it's always good for people to understand not only, what they're taking and how to take it, but why and what it's doing for them. And that can alleviate a lot of the nerves. So thank you for that awesome overview of what Gonal F is all about. So this question comes up quite often. I know you've actually answered this on the show before, but a lot of people are having some questions around overfill. So this has been coming in. It says, I'm a little concerned or confused about the overfill. I'm just not sure. How does that work to my advantage?
Yes, this is definitely a hot topic, and that's because with the overfill, you're actually getting more bang for your buck with the medication. So typically when your nurse orders your medications and quantities based on whatever dosage you are prescribed by your provider, they'll typically take into account, the amount that's on the label of the medication that they prescribed you. But with the overfill, there's more in there than what's on that front label. So you want to be sure that you are using every last drop out of that vial, even though if you were to do the math and, divide your dose by the amount of IUs that are in the vial, you probably have an idea of how many days that's going to last you. But with the overfill, that you'll get more out of that vial than whatever that, that day's allotment was that you calculated. So good rule of thumb, just continue to withdraw the medication from the vial until you're completely empty. There's nothing wrong with using every little last drop out of there. That's what it's there for. So I definitely recommend and tell my patients all the time to utilize that overfill.
Thank you very much, Caitlin. Yeah, that's great because we know a lot of times people think of it like when you fill a prescription of pills, right? And the pharmacist obviously doesn't say, here's a 5 extra just in case,
Right.
you go over. So it's a little bit different because of the injection. And hopefully that answers any questions. And again, one thing we always like to bring up on the show, if you hear a question that actually makes you think of that answer, makes you think of another question, a follow-up, we will get back and allow, like at any point throughout the show, you can bring up questions, at the end about things that we talked about in the beginning. So just keep thinking about any questions that pop up as we go. Just like this one that just came in, just a basic storage question. It says, what is the safest way to store my medication in the house? How about when I'm traveling?
Great questions. For the multi-use gonal F vial, prior to mixing the medication, you can store it one of two ways. So either at room temperature or in the refrigerator. Either way is fine as long as you haven't put the water into that powder yet. Once you have reconstituted it, or once you've mixed that saline into that powder, then you do need to store it in the refrigerator. Other good tips, just keeping it, out of the hands of maybe little ones or pets, things like that. So keeping it maybe towards the back of your refrigerator, or if you're keeping it at room temperature, up on the counter, things like that. If you are traveling with the medication, that's a common question as well. So if you have mixed that water with the powder and it needs to stay cool, I would surround it by ice packs or put it in like a small lunchbox, something like that. You do want to keep it at a refrigerated type temperature to make sure that that medication stays good the appropriate amount of time that it should.
Awesome. And so that, as of right now, that is, we've kind of wrapped through the questions that we've gotten through. So as always, we like to give just, another 30 seconds or so. If you're thinking of a question and you haven't had time to get it in yet, we'll give you a little bit of time to get that in. And in the meantime, I will throw it back over to you, Caitlin.
Great. So I know I just kind of touched on how to store it, refrigerator versus room temperature, depending if it's been mixed or not. Keep in mind as well, as far as expiration dates and that sort of thing goes, that this medication is good for 28 days once it's been reconstituted. So the day that you put that water into the powder, you're on a 28-day time clock. Typically for an IVF cycle, you're going to have no problem using up what you have. Typically cycles aren't that long. So, but if for some reason, something happens with your cycle and it's delayed, canceled, life happens, then be sure to note what date you reconstituted that vial and be sure that if it's been past 28 days, you're probably no good at that point with that med. If it has not been reconstituted, so it's still just powder with your syringe of water, then it's good until the expiration date at that point. So just some things to remember.
Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it.
All right. So I'm ready for any questions that have come in.
All right, thank you very much, everybody. And remember, if you do have any questions, you can just type them right either into the chat or directly into the Q&A box. We will definitely get to them. And unfortunately, one question I'll just throw out there. If anyone is listening to this after the fact on Facebook, please feel free to message us if you do have questions based on the video. We will pass any of those questions on to Laurel, and we will get an answer and get back to you. So I do apologize for the issue there. But the first question that's coming in, Laurel, I just want to see. You were talking a little bit about how to mix it, and it seems like there were some questions just around like how it looks beforehand. And it says here, how important is the way the Menopur looks prior to mixing? Does it take long to mix once I inject the liquid? So kind of it looks like a dual question there.
Okay. The medication is going to look like a disc of powder. In fact, I have a sample here to show you. It looks like this. It's this little disc of powder, and it will dissolve instantly once the liquid touches it. So no problems with it mixing. It should just dissolve really, really fast.
Perfect. Thank you very much. And we've obviously heard the question about the way Menopur looks, so it's good to hopefully put that to rest for a lot of people so they don't feel like there might be something wrong with it. Okay, so another one came in that says, I read that using more liquid can make the injection less painful. Is this true, or does the liquid amount not actually matter?
So that's a good question. When you give a subcutaneous shot, you don't want to give more than 2 milliliters of liquid. But if you use more liquid, it's going to end up hurting more. So what we recommend is to use 1 milliliter of the liquid to mix up to 4 vials of Menopur. And that's perfectly fine. If you are using only 1 vial of Menopur, feel free to use 1/2 of a milliliter of liquid or up to 1 milliliter of liquid, and that is perfectly fine. When you get up more than 1 milliliter, you're going to see that it's going to hurt a little bit more. And the goal is to make this hurt as little as possible. And the trick to that is to give this shot as slowly as possible.
Perfect. Thank you for clearing that up. And just to reiterate that it is more liquid can make it actually potentially more painful, not less, which this question I was asked, the person asked, so we just want to make sure that they pick up on that. So a question about the Q cap that you walked through the process on how to use that. And it says, is the Q cap necessary? Can the mixing just be done with one of the needles that I already have?
Good question. So the Q cap is a really nifty needleless mixing device, and I highly recommend using it. However, if you didn't get it, or if you would prefer to mix with a needle, you can do that. What you would do is you would add the long needle onto the syringe, and you would put the 1 milliliter of air into the syringe, push that into the liquid, draw back 1 milliliter of liquid, mix your powders just like you would if it was a Q cap. And when you're all done, you're going to want to take that long needle off and put a short little 1/2-inch needle, the giving needle, on, get rid of the air, and give the shot. So that is perfectly fine to use a needle if you prefer.
Perfect. Thank you so much. Great answer. And one other question comes in here that talks about, so we got this one actually pretty often. This comes through quite a bit, and I think this is a perfect time for it. So I'm taking a number of different shots, and I was wondering, what exactly is Menopur? What impact does it have on my cycle?
Good question. So Menopur is a purified FSH, and it has luteinizing hormone, or LH, added to it, which is also an important hormone in stimulating the ovaries in an IVF cycle. So what FSH does is it stimulates the ovaries to mature the eggs. The follicles are called the antral follicles. Those are the ones that are going to potentially mature, and it will stimulate all of those antral follicles to get to the mature state so you can have a successful egg retrieval. It does, however, have the side effect of making your ovaries larger, so you can get some bloating because of it.
Thank you very much, Laura. That's great. Hopefully that helps everybody just kind of get an understanding. Not all the questions have to be about, am I doing this correctly, or how does this, how do I give this shot? But it can just be more like, I'm not even sure what I'm taking. So thank you for clearing that up, and thanks for asking that great question. So as of right now, Laurel, we've gotten through the questions that have come through. I'll kick it back over to you. So if you're trying to get in that last question, you're trying to type something out, we'll give you another 30 seconds or a minute to get it out there. But Laurel, in the meantime, I'll throw it back over to you.
Okay. So Menopur does have potential side effects. As I said, it causes the ovaries to get bigger, and that's because every follicle is getting bigger. It starts out very, very small, and it gets to be the size of about a grape. So not 10 grapes developing, 10 eggs developing on each ovary, which is a fairly common number for women going through an IVF cycle. You're going to get pretty big ovaries. The ovaries start out about the size of a walnut, and then they grow. They can get as big as an orange. Hopefully not that big, because that is painful. But what you're going to experience and expect to experience is some bloating and some heaviness. You're going to feel like you're carrying a couple rocks around in your pelvic region, one on each side. So it's sort of that heaviness. You also may experience some bruising at the site. And you just want to make sure that with any next consecutive shots, you don't give them into a previous bruise. And that bruise should heal over about a week's time. It's not a problem. It doesn't mean the medication didn't absorb. It's just one of those potential side effects. And I think that's about it for Menopur.
This medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach an implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported again, where that pregnancy is growing until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandel's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you, and hold off. You don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy when you do receive this medication. But definitely get it out of the box and leave it on that counter or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is at our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection, and that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Cinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've got a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area, so we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there, progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that. So keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge inch injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle, but then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply, so you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is if you don't have prep pads, regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay, but most of the pharmacies, and I know the pharmacy Mandel's, they do supply this to their customers, so I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, and we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it, and that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air, and then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles, because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication, okay? So you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle. Put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it, okay? So multi-dose vials are good, because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically, to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do. I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered that's sterile, and you can run it over a little bit of warm tap water to just, once again, do what you can to sort of, it's to make it a little less thick when you go to give that injection. Okay, so those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. This is, the side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is, when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is, we're marking what's called the upper outer quadrant of the buttocks to administer that shot, so you don't even have to worry about that sciatic nerve, because where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sonera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting because you're not putting in a lot of fluid or a lot of medication. Really, with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection when we do have to administer is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down, okay? With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that, if I stand, is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do, if I were administering and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sonera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary. What I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed, the needle down to the floor, and it's not parallel to the floor. It's roughly 45-degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person, and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip, because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid, because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3, and then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it'll stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sonera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay? So remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone.
Okay, thank you, Wanda, very much for that excellent presentation. And now it is time. We will open up for questions about the progesterone and oil. Any questions you may have, remember you can type those into the Zoom, either in the Q&A or the chat. You can also share those directly into the Facebook if you are on the Facebook Live watching the Facebook Live program. If you're watching there, you can definitely put in any questions. So that brings us to the first question for you, Wanda, today. It says, how do I store my progesterone in between shots? Is it okay to take it with me if I need to?
Absolutely. If you need to transport with it, progesterone is easy to do so because you only need to leave that at room temperature. So think about when you have oil stored in your home that you might be using on a salad, olive oil, canola oil. Since this is an oil-based medication, typically what you do with that is you keep that oil at room temperature. So easy to carry along with you because of that. And in between injections, keep it stored. Sometimes I do get the question of, do I reattach, because it's a multi-dose vial, do I reattach the lid? Do I have to cover it? And as I mentioned in the video there, yes, it's going to be a multi-dose vial, meaning you will draw up more than one dose, but just wiping that top with a little alcohol, removing any little surface bacteria is fine. Anything that can be on the surface, wiping the top every time you go into it with a needle, that is sufficient.
Awesome. Thank you very much. This is similar to the previous question a previous question that was asked about HCG as well. I think people are just trying to get a little bit of a better understanding of how all these products work. And you touched on this at the very end, some of the real benefits of when you're on progesterone, what that's doing for you. But I guess just a little bit more in depth, if you could share, how does progesterone help my cycle is the question.
So progesterone's influencing the lining of the uterus. It's preparing it as we have in a natural ovulatory cycle. After we ovulate, our bodies start to secrete from that corpus luteum that we've ovulated an egg, and that corpus luteum helps our body to produce some progesterone that then influences the lining of the uterus before a fertilized egg develops and becomes an embryo in that uterus. So the place for an embryo to land and a pregnancy to grow and develop is within the uterine lining. And progesterone's all about uterine development after you've had the procedure or after you've had an ovulation. So that's why usually progesterone is done once a retrieval has taken place. You start progesterone, or even with an intrauterine insemination, there might be other forms of progesterone you might be on, but typically it takes place after the procedure because now you're preparing for pregnancy.
Great. Thank you so much for making that so easy to understand. And if anyone has any other questions about that, do not hesitate to throw those questions out to us. But this question that came in, So you were talking a lot about the intramuscular nature of this and how to utilize that and what, the potential things to be aware of or to look out for. This question came in that says, how do I know if I'm inside the muscle? Is it dangerous if I don't get it exactly in the muscle? How can I be sure?
I think you can be certain, or I should say reassured, because at your center, oftentimes you are having blood drawn that's measuring progesterone levels. So certainly I'm not here to represent all clinics, but at my clinic, we do that where we measure a patient's level of progesterone during their cycles before procedures and after procedures. And the point of checking that is there's a level that we want it to be maintained at. So that's one of our ways of being reassured, even as your clinicians, if we needed to change anything with your dosage or add anything with progesterone. So I think you can be reassured that if your blood levels, when they're coming back, are detecting nice levels of the progesterone, that indeed that is circulating in your system and you're on enough of a dosage. But if for any reason there's ever something that needs addressing and progesterone might need to be added, a dosage might need to be increased, we can address that right away once we see that. So usually though, the physical part of it that you might notice if you are getting in the muscle is just like I mentioned in the video, like when we get little muscle shots here in the deltoids, and they feel a little like a bruise. That's more often what you'll notice in that buttock if you touch at it. It just feels like a little bruising sensation. Even if a little bit of that medication is in the fatty tissue, it does break down. So it's okay because we have fatty tissue that precedes the muscle tissue. And even if a little of the progesterone gets into that fatty tissue, it's going to break down as well. But some of those little tips about heat and alternating the site a little bit and gentle massage, these are all things that help break it down as well, whether it be in the muscle or whether anything leaks back into that fatty tissue.
Excellent. Thank you very much, Wanda. And then this one just came in on Zoom. You had mentioned both ice as well as the Sonera patch as options for something that you can use to try to help, proactively alleviate some of that potential discomfort. But the question still came in and said, I'm still a bit nervous about this shot. Is there anything else that I can do to help alleviate pain, discomfort, or any mental discomfort I may have?
We're going to address that actually at the end of this. We're going to have one more video to show, but I am going to be providing you, and it'll show up on the screen, and then it'll be attached for you to be able to possibly look at it again. I am a certified healing touch practitioner, so what I'm involved in with that is that's all about relaxation techniques, and I do think that's important for you. So the self-mind clearing that I'm going to be providing with you tonight, or providing for you this evening, is one of the extra techniques that I'm giving you to be able to create a sense of calm and peace. And that can be helpful because sometimes when we have a lot of stressful things going on, our physical body can seem a little more sensitive to us, and we might be a little more sensitive to the medications going in and the apprehension. So the whole goal here, I feel from my standpoint as a nurse and as well as a certified healing touch practitioner, is to give you an extra little benefit tip that I will share at the end of this, at the last video, and I'll show you some little techniques that you can do. One is specific to mind clearing that helps to promote relaxation. A relaxed mind is going to help have a relaxed body, which is going to allow these medications to come in and the injection technique to be a lot easier for you, or help aid that injection technique.
I want to thank all of our nurses tonight for their amazing performances that they gave walking through these different products. Hopefully the Q&A section was helpful for you. And we are going to be returning next week with a live program on both Zoom and Facebook Live at 7 p.m. Eastern Standard, as always. Do not forget that all these virtual learning experience videos, as well as the individual product demonstrations themselves, are available on demand on our YouTube page, our Facebook page, and at our homepage with mymandelsPharmacy.com/pharmacist, where you can go and check out any of these archives. We look forward to seeing you all here again next Monday night at 7 p.m. EST for another great program with live interaction and Q&A as well. Please share this program with anyone you feel can benefit from it. That's the best way to get the word out. And thank you again for an amazing program. Thank you for your time and interest. You're going to be a pro at this. Best of luck to you and good night.